Hi, I'm Sanjay Purkayastha. I'm a metabolic and bariatric surgeon, and I work at OneWelbeck Digestive Surgery. I also work as part of the team at the Imperial Weight Center, and I'm the lead surgeon for surgical weight matters. The common fallouts that we've seen from COVID as weight management experts and metabolic surgeons are not just the increased weight of presentation of patients, but all the other comorbidities that come with increased weight. We've seen increased presentations of severe type 2 diabetes, obstructive sleep apnea, cardiac problems, lung problems like asthma, gastroesophageal reflux, and also issues with polycystic ovarian syndrome. The three main pieces of advice that we would give to patients who have put on significant amounts of weight during the pandemic are, firstly, don't worry. We're all here to help. We have a fantastic multidisciplinary team that will be able to help you, not just with your weight, but with prevention of future weight gain. The second thing is that surgery really for weight gain is the absolute last option with us. We have so many other therapies, from talking therapies, pharmacotherapies, and nutritional therapies that will be able to get you back to your optimal weight. Finally, the other conditions that are associated with increased weight, particularly if it's been over the course of 6 to 12 months, they are all conditions that we can diagnose and optimize as a team, with you as the most important member of that team working together. For patients who have put on significant weight and are unable to turn that around, there is significant risk of obesity-related comorbidities. These can be long-term issues with type 2 diabetes and kidneys, heart disease, lung problems, obstructive sleep apnea that can present with disordered sleeping and tiredness and daytime somnolence, back pain, joint pain, and a multitude of other issues, all of which are completely reversible if they are picked up and treated in time. During the pandemic, many people have felt that they didn't want to trouble their doctors, the NHS, or even private providers with their problems because they were trivial. Patients who have had metabolic or bariatric surgery need long-term follow-up. Patients who have not adhered to their follow-up, or some patients who have developed pain or new symptoms during the pandemic and have not presented, have ended up presenting as emergencies and have had much worse outcomes than they would have needed had they come to a centre like ours sooner. It is really important not to ignore symptoms of pain, nausea, vomiting, or even tiredness or lethargy. We also help patients who are underweight or have disordered eating issues. We can help with all of these micronutrient deficiencies, whether you are underweight or overweight. Our team here at OneWelbeck encompasses not just metabolic surgeons and physicians, but a whole array of colleagues that work together, all in one building, with all the relevant diagnostics at the tips of their fingers to be able to help you. It is really important to understand that optimum weight management should really be about prevention and should be proactive rather than reactive. If you are starting to have issues with your weight, diet, or eating habits, please get in touch with us sooner rather than later. Our specialist multidisciplinary team, with its nutritional and talking therapy input, could really turn this around for you so that you won't need to take medicines or even consider surgery in the future. You will be able to make all the changes for yourself from within.